Mainline glucose metabolism provides our cellular energy, yet the most severe metabolic pathologies often originate in specialized side channels branching off the primary glycolytic chain. Think of carbohydrate metabolism as a biological transit map. Down the center runs the primary spine of glycolysis, with specialized side channels branching off to process alternative sugars or store fuel. When an enzyme fails on these peripheral routes, the flow hits a dead end. Chemical intermediates accumulate behind the roadblock, leaking into tissue and triggering a cascade of organ damage. Diagnosing these metabolic disorders is a process of mapping systemic symptoms back to specific enzyme failures. This diagram outlines a major detour, the pentose phosphate pathway, or HMP Shunt. It branches directly off glucose 6-phosphate. As the reaction flows, it serves two purposes: synthesizing ribose 5-phosphate for nucleotides and generating NADPH, a vital reducing agent. The entire shunt stops if a patient lacks the very first enzyme, glucose 6-phosphate dehydrogenase, or G6PD. Without it, cellular production of NADPH ceases. Red blood cells rely on NADPH to neutralize free radicals. Deprived of this shield, sudden spikes in oxidative stress cause the red blood cells to distort and rupture in the bloodstream. The HMP shunt acts as an intracellular defense system. Missing its primary enzyme leaves the blood exposed to destructive hemolysis. Notice how fructose metabolism on the right bypasses the tight regulatory checkpoints of glucose. Because it skips these initial bottlenecks, defect location determines severity. Missing fructokinase is asymptomatic, but a defect lower at aldolase B creates a crisis. Aldolase B deficiency traps fructose 1-phosphate inside the liver cells, exhausting the cell's free phosphate supply and halting glucose production. This leads to severe hypoglycemia and liver failure, known as hereditary fructose intolerance. A similar structural trap exists for galactose, the monosaccharide derived from milk. When the GALT enzyme, shown here, is defective, galactose 1-phosphate accumulates in tissues. This is classic galactosemia. Affected infants develop jaundice, liver damage, and pediatric cataracts. For these alternative sugars, a downstream enzyme block traps phosphorylated intermediates inside the cell, poisoning the organ from the inside out. The body stores surplus energy as glycogen, a massive branched polymer of glucose packed into liver and muscles. During fasting, enzymes clip off glucose molecules for energy. Glycogen storage diseases occur when mutated enzymes trap this fuel in storage. In type 1, von Gierke disease, a glucose 6-phosphatase defect prevents the liver from releasing glucose into the bloodstream, triggering severe fasting hypoglycemia. Type 2, Pompe disease, targets the lysosomes, the cell's internal recycling centers. Because these lysosomes lack the acid alpha-glucosidase enzyme, glycogen swells inside muscle tissue, leading to profound weakness and fatal cardiac failure. In type 3, Cori disease, a debranching enzyme defect causes liver enlargement. Because patients can still break down the outer glucose chains, their hypoglycemia is milder than in type 1. Type 5, McArdle disease, is isolated to skeletal muscle through a deficiency of muscle phosphorylase. Without this enzyme, muscles cannot mobilize local glycogen stores during exertion, causing severe cramps and exercise intolerance. Differentiating these diseases requires matching the failing organ to the broken enzyme. Liver failure indicates von Gierke, heart failure suggests Pompe, and muscle cramps point to McArdle. These specialized pathways for the HMP shunt, alternative sugars, and glycogen storage all branch directly off the central glucose highway. A block in the HMP shunt results in a loss of NADPH, leaving red blood cells vulnerable to oxidative stress. Defects in aldolase B, or GALT, create intracellular traps, causing toxic accumulation and liver damage. Glycogen storage diseases follow the organ. Von Gierke affects the liver, Pompe affects the heart, and McArdle affects the skeletal muscles. Identifying the specific enzymatic roadblock clarifies the source of systemic failure, making these complex biochemical pathways a reliable diagnostic guide.